Good morning, Mrs. Lee. I was told your child has had a persistent high fever for 6 days, along with red eyes and cracked lips. Is that correct?
係，佢大概6日前開始發燒，到而家都仲未退，啲眼成日紅紅地，嘴唇又乾又爆，有時仲會滲血，我真係好擔心。佢呢幾日好易發脾氣，又冇乜精神。
Based on what you've described, I'm concerned that your child may have a condition called Kawasaki disease. It's a rare but serious illness that causes inflammation of the blood vessels throughout the body. If not treated promptly, it can sometimes lead to complications affecting the heart.
呢個係咩病？危唔危險？
Kawasaki disease is an inflammatory condition that mainly affects young children. It causes inflammation of the blood vessels throughout the body, which can lead to symptoms like fever, rash, red eyes, and swelling of the hands and feet. The good news is, if we treat it early, most children recover completely without long-term problems.
佢胸口同背脊有紅疹，對手睇落去腫，佢都話有喉嚨痛，條脷好紅好怪。
Those findings of the polymorphous rash, peripheral edema or erythema of the hands and feet, strawberry tongue, and non-purulent conjunctivitis do fit the classic mucocutaneous lymph node syndrome criteria we use to diagnose Kawasaki disease.
佢頸側左邊有粒腫起嘅嘢，按落去會痛。
Unilateral cervical lymphadenopathy larger than 1.5 centimeters often appears, and together with prolonged fever and mucocutaneous changes, it strengthens our clinical suspicion.
要做啲乜嘢檢查先可以確定係川崎症？
To confirm the diagnosis, we'll start with some blood tests to check for signs of inflammation, such as high white blood cell count. We'll also look at his liver function, platelets, and electrolytes. In addition, we'll do a urine test to see if there's any sterile inflammation. Finally, we'll perform an echocardiogram and possibly an ECG to check if the blood vessels are affected in any way.
治療方式係咩同埋幾時開始？
We usually treat it with a medicine called intravenous immunoglobulin. It's given through an IV drip and helps reduce inflammation and lower the risk of complications. This medicine works best when it's given within the first 10 days after the fever starts. Since your child is on day 6, we still have time. We'll start the medicine as soon as we finish all the necessary tests. Along with that, we'll also use a small dose of aspirin to help reduce inflammation and support blood flow.
呢啲藥有冇副作用？會唔會影響佢之後嘅成長發育？
Most children tolerate it very well. Some may experience mild side effects, like a headache, fever, or a bit of nausea during the infusion, but we monitor closely and can slow down the drip if needed. Serious reactions are very rare. As for aspirin, the dose we use is very small, so it usually doesn't cause problems.
呢個病會唔會影響佢之後嘅成長發育？
If we treat it early, which we are, it usually won't affect your child's growth or development at all. Most children recover completely and continue to grow just like other kids.
佢發燒嘅時候就好似有啲氣喘。
Shortness of breath can occur from fever and tachycardia, but we'll screen for myocarditis using ECG changes and the echocardiogram to look for ventricular dysfunction or pericardial effusion.
我唔太明白你講乜嘢。
What I mean is, we're just doing a few tests to make sure your child's body is handling the fever okay. We'll check his blood to see if there's inflammation, and we'll take a quick scan of his heart with sound waves just to make sure everything looks normal. None of the tests are painful, and we'll explain each step as we go.
佢要唔要留院？大概要幾耐先會好返？
Yes, he'll need to stay in the hospital at least overnight so we can give him the IV med treatment and make sure he responds well to it. Most children start to feel better within a day or two after the medicine, and their fever usually goes away. We'll also keep checking his temperature and monitor him for any side effects. Once everything looks stable, he can go home to rest.
可唔可以幫我寫張俾學校嘅請假信？前幾日我已經帶佢去睇過家庭醫生，嗰陣時佢淨係發燒，冇其他症狀，我哋都以為只係普通發燒，嗰個醫生淨係幫佢寫到尋日。
Of course, I can do that for you. I'll prepare a note explaining that your child has been diagnosed with Kawasaki disease and needs to rest at home for a few more days after treatment.
多謝你，醫生，真係好感激你幫忙。如果可以嘅話，可唔可以唔好喺假條上面寫川崎症呢？我驚學校或者其他家長會誤會。或者對佢有啲偏見，你寫佢因為健康原因要多休息幾日就可以啦。
I won't include the specific diagnosis on the note. I'll just write that your son is being treated for a medical condition and needs several days of rest at home before returning to school. His privacy is important, and we always make sure our notes protect that.
幾時會寫好啊？你係唔係而家幫我寫？
It'll be included in his discharge papers. Once he's ready to go home, we'll give you all the documents together, including the school note.
唔好意思，太遲啦，我個仔間學校對出席率好嚴格。我一定要喺今日之內影張請假信俾佢哋，可唔可以幫我早啲寫好？咁樣我可以即刻影相發俾學校。
Of course, I understand. I'll write the note for you right now so you can take a picture and send it to the school today. It'll just take a few minutes. Let me make sure everything is worded properly before I hand it to you.
我唔係想催你，不過我之前真係遇過類似情況。幾個月前我個女出咗水痘，差唔多2個禮拜冇返學，到佢好返嗰日我帶佢返學，當場交張請假信俾校長，結果校長竟然鬧我，話我應該早啲交，所以我一定要今日就將假條發過去。
Oh, I completely understand, Mrs. Lee. That must have been really upsetting for you. Some schools can be very strict about documentation, even when parents are doing their best. I'll make sure you get the note before you leave today, so you won't have to go through that kind of stress again. You're doing the right thing by being careful and responsible.
真係好多謝醫生，不過我仲想問多樣嘢，呢個病會唔會傳染㗎？我驚我個女都會被傳染。
Kawasaki disease is not contagious. It doesn't spread from one person to another like a cold or chickenpox. We still don't fully understand what triggers it, but we know it's related to how a child's immune system reacts, not to germs that can be passed around. So your daughter and other family members are safe.
佢點解會有呢個病？如果唔係傳染，係咩原因令小朋友會有川崎症呢？
That's a very good question, and you're not the only parent who asks that. The truth is, we don't know the exact cause of Kawasaki disease yet. What we do know is that it's related to the body's immune system overreacting to something, maybe a common virus or environmental trigger, and that reaction causes inflammation in the blood vessels. It's not because of anything you did wrong or could have prevented. Sometimes these things just happen, and the most important part is that we caught it early and are treating it right away. 佢今次治療完之後，將來仲會唔會有後遺症？係唔係好似有啲病毒會留喺身體入面，大個咗又會發作？ Kawasaki disease isn't caused by a virus that stays in the body, so it won't wake up again in the future. Once the inflammation is treated and the blood vessels heal, it doesn't come back in most children. There's no virus hiding or sleeping inside him. The only thing we'll do is keep following up with heart ultrasounds for a few months, just to make sure everything stays healthy, but long-term problems are very rare, especially when treatment is started early like in his case. 出院返屋企之後，有冇啲咩要特別留意？例如飲食要唔要改下？佢要唔要多啲休息？定係有啲咩活動暫時唔做得？我只係想確保自己做得啱，幫佢快啲康復。Once you're home, just let him take it easy for a few days. He can walk around and play quietly, but avoid running, jumping, or any sports until we see him again at his follow-up visit. Make sure he drinks plenty of water and eats a balanced diet. There's no special diet he has to follow, just regular healthy meals. If he feels weak or gets another fever, give us a call right away. Other than that, most kids recover very well and get back to their normal routines in no time. 真係好多謝醫生，請問我哋幾時要返嚟覆診？ You're very welcome. For follow-up, you can see his regular pediatrician in about a week. They'll check how he's recovering and make sure everything looks good. 呢個病有冇疫苗可以預防？我真係唔想佢再經歷多一次。Right now, there isn't a vaccine that can prevent Kawasaki disease. Since we don't yet know exactly what causes it, scientists haven't been able to develop a specific vaccine. The good news is that once a child has recovered, it's very rare for it to happen again. Most children only get it once in their lifetime and go on to live perfectly healthy lives. 你啱啱講過呢個病會令血管發炎，係邊啲血管受影響？係身體某個部位嘅血管定係全身啲血管都發炎？ Kawasaki disease mainly affects the medium-sized blood vessels, especially the ones that supply blood to the heart. We call those the coronary arteries. That's why we do heart ultrasounds during and after treatment, just to make sure those vessels stay healthy. The inflammation can also affect blood vessels in other parts of the body for a short time, like in the skin or joints, which is why some children get rashes or swelling. But once the inflammation settles, the blood vessels usually heal completely.
你話係心臟嘅血管，係唔係代表佢嘅心可能會受影響？佢而家個心有冇事？佢而家係唔係有危險？
Mrs. Lee, I completely understand how worried you are, and I promise we'll talk more about this in just a little bit. I'm so sorry, but there's an emergency I need to attend to right now. I'll be back as soon as I can to continue our conversation.